More than 1 in 10 people affected by COVID-19 in 314 UK hospitals became infected in the hospital during the first wave of the pandemic, according to a recent study. The hospital infection research was conducted by Dr. Jonathan Redd from Lancaster University together with colleagues from other British universities, Liverpool, Edinburgh, Birmingham and Imperial College London, and was directed and published in The Lancet. The researchers examined data on COVID-19 patients in UK hospitals who participated in the International Severe Acute Respiratory and Emerging Infections Consortium Clinical Characterization Protocol UK. That's complicated. And before August 1st got sick last year. The researchers found that at least 11.1% of COVID-19 patients in the 314 UK hospitals became infected after hospitalization. The proportion of people infected with COVID-19 in hospital rose to 16 to 20% in mid-May 2020, long after the hospitalization was high in the first wave. We estimate that between 5,699 and 11,800 patients who were hospitalized in the first wave were infected during their hospital stay, write the study authors. Unfortunately, this estimate is probably still underestimated as we did not take into account those patients who may have been infected but were discharged before they could be diagnosed. Dr. Jonathan Redd, lead author from the University of Lancaster, states, controlling viruses like SARS-CoV-2 has been difficult in the past, so the situation could have been much worse. In hospitals and care facilities, however, infection protection should still have priority. Dr. Chris Green of the University of Birmingham says, there are likely a number of reasons why many patients in these care facilities have become infected. These include the large numbers of those admitted to hospitals with limited opportunities to isolate cases, as well as limited access to quick and reliable diagnostic tests in the early stages of the outbreak. Difficulties in accessing and optimally using personal protective equipment also play a role, as well as our understanding of when patients are most contagious during the course of their illness, as well as a certain number of misjudgments of cases due to a presentation with atypical symptoms and an underestimation of the role of airborne transmission of the virus. Depending on the type of care, there were clear differences in the number of infected patients in the hospitals. Hospitals offering acute and general care had a lower proportion of hospital-acquired infections with just 9.7% than nursing homes with 61.9% and psychiatric facilities with 67.5%, which is consistent with the COVID-19 observed in nursing homes and their outbreaks there. Professor Callum Semple of the University of Liverpool said the reasons for the differences between facilities offering the same type of care require urgent investigation in order to determine and promote the best infection control practice. A study has now been commissioned to find out what has been done well and what lessons need to be learned to improve patient safety. Dr. Anne-Marie Doherty of the University of Edinburgh added, the underlying causes of these high transmission rates in the hospitals at the height of the first wave need to be investigated so that we can improve safety and outcomes for our patients. The rates are significantly lower a year later, and people shouldn't be deterred from going to hospitals if they are not comfortable. And I'll see you in my next video. Bis gleich.